My name is Lorraine.
I'm gonna have to go through and mute some people so we get a less sound interference. Sorry, guys.
No problem. I'm unmuted now. I think you can hear me. Okay, great. So my name is, forgive me, my name is Lorraine Valentin. I am the Manhattan Borough Outreach Director for Test and Trace. I'm going to be sharing some information.
Sorry. Good.
Okay.
Yeah, no.
Unmuted. All right. Thank you, everyone. I'm going to just go ahead and go along with our presentation right here that I'm going to share with everyone. Okay, great. So as I said, my name is Lorraine Valentin. I'm the Manhattan Borough Outreach Director for the New York City Health and Hospitals Test and Trace. We're the crazy people on the corner or behind tables giving out PPE and palm cards promoting the 4 core. My partner, Nye Whitaker, is the Manhattan Outreach Partnerships person who connected us last week. So we were on here with a few folks. So we're going to go right into it. These are the cases since last March of 2020 up to now, January 2001, per the Department of Health mental hygiene page. As you saw, we saw a dip during the summertime, and then we started to see an increase towards the fall. At the bottom where it says probable cases, that is new data. That is the antigen test. So there are various tests we've evolved since testing has been made available to the public. In the beginning, as you all are aware, testing was only available to first responders and essential workers. It was not available to the public. We weren't really able to start getting testing until sometime mid-April and May, where folks here in New York were really responsible. When we find out that we test positive for COVID, we quarantine at home. And so the tests have evolved from long stem testing to now short stem testing. We also now have the ability to test for antibodies, meaning if you've had COVID before, and also an antigen test, which tells you if you have COVID now. We also have a rapid test so that you can get fast results. It's not 100% reliable, 100%, 99.9% is the PCR with the short stem, no swab. And these are the cases with the SAT scan, which we're very concerned with the positivity rate. These are the trends, so you can see what we've been seeing in October. Again, on the gray scale is the folks who have taken the antigen test, which tells you if you've had COVID now at that time. And so over here in the maroon color, that is Staten Island. And then we have Queens, we have Brooklyn, the Bronx, and then the island of Manhattan, where we're doing just a little bit better than the rest of the 5 boroughs there. These are the Manhattan positivity rates beginning of this week per zip code. And the reason why we do it per zip code is that in New York City, we know that we can cross up to 4 zip codes in a day traveling to work or to our doctor's offices or, to school or wherever. And so it's really important to see what's happening to understand the trends in the neighborhoods near and around us. And so that you can understand why we have some concern and why we're mainly focused on putting a lot of canvassers and testing teams in certain areas as soon as we see the numbers spike. And Gemma has this, so she'll circulate this to everyone, by the way. And these are the numbers that you can see on some of the links that I'll share at the end here, which you'll also have. So what do we do in response to the numbers? Right now, we're focused on non-pharmaceutical interventions since mass vaccination is not available. This is an example of an event that we did on Tuesday. Get Tested Tuesday is an event that we feature every week in the Test and Trace outreach world. You've probably heard the mayor tweet it out or mentioned it in some of his public briefings, press conferences. This past week, we did a citywide Get Tested Tuesday to kick off the day of service honoring Dr. King. In order for us to see Dr. King's legacy, we need to be here, alive and well, to see it fully through. And so these are some of the areas where we focused our Get Tested Tuesday, but weren't limited to, where we handed out PPE, we answered questions on vaccination, but we also handed out some literature on free resources from the city, such as the Get Food, but also our hotel programs. And so we published this to the public so that folks know to come and see us if they're in the area and pick up some of the free resources that we have available. At times, we even have hand sanitizers and face shields available for folks. These are some of our outreach efforts in Manhattan, just to give you a snapshot of what we're doing, our response to outreach. And so we also have a public testing, a public drive, where every Sunday we update the flyer for our testing sites that are just popping up for the week with the mobile test trucks or microsites. And so, for example, Canaan Baptist Church has a mobile test unit outside, and that's on West 116th Street. The NYCHA Playgrounds, there's a mobile test unit right off of the train station there. Word Up Community Bookstore, Councilman Mark Levine hosted a microsite yesterday for one day at his location. And then we've actually done a mass distribution of 74,500, but with the Biden-Harris administration on Monday, we gave out a total of 92,000 in one day. So we had PA associations come and pick up PPE to distribute to some of the folks. I had some folks who were doing specific outreach to seniors that they knew in certain pockets where it was 20 or 50, and so they would pick up for their folks to drop off to some of them. And so, you know, as you see here, there's also, I was talking about the test evolving self-swab locations, but these are facilitated by healthcare workers who will teach you how to swab yourself and take the specimen and mail it out so that you can get your results. This is an example of what the Manhattan testing site flyer looks like. Forgive me, it's really small even for my eyes right now. I had to shrink it just to give an example, but Gemma also has this, so she'll be emailing this out to folks. And that's that blue link that was on earlier on this one. That's where you click every Sunday and you'll see the you'll see the additional testing sites on here, and they'll indicate which are rapid, which ones you can do by appointment only, so that if you know you want to go to a specific time, and which ones are COVID Express. So when we're talking about testing positive, what does this mean? Or maybe being in contact with someone who was positive. The tracing team will call you, and this is exactly what it'll look like. You'll have this on the call ID that says NYC Test and Trace. This number will populate. Please answer the phone. This is not a scam. This is the actual New York City Test and Trace company reaching out to you to either make you aware that you've tested positive and help you access other available resources the city has for you. And we don't just leave you alone when you test positive or you come in contact with someone who tests positive. We follow through all the way to ensure that you have, if you need to quarantine, and you live in a multi-generational home or with other folks, that we can get you to a hotel, and we pick you up and we drop you off. It's not instant, so don't think just because you call, then you'll get a call a few hours later to confirm this. And then they'll make sure when you quarantine, if you choose to quarantine at a hotel, that you have 3 square meals a day, and they are up to par. I promise you, they have everything from kosher to Latinx meals there. They'll give you a tablet so you can stay in touch, a tablet or a phone so you can stay in touch with your family and loved ones. There is medical staff on site to deal with any complications due to COVID, or if you had any other medical conditions moving forward. And also, they will make sure that you get medication if you have, for instance, if you're taking medication for diabetes and whatnot, they'll make sure that gets to you as well. But if you decide to quarantine at home, we also have take care programs. In the interim, let's talk about the vaccine. And although it's not available yet, we have a supply and demand as of, if not tonight, by tomorrow, New York City Health and Hospitals will no longer have any vaccine. So we're praying that through the Biden and Harris administration, our president has just signed off on a COVID-19 federal reprimand or demand as of yesterday to increase the amount of vaccinations across the country, including New York City. And that comes with a new deployment plan. So we're hoping to get that sooner rather than later. We're focused on equitable distribution, including acknowledging history and current experiences of racism and bias in medicine. And we're looking to partner with community organizations, elected officials, city agencies, and sector partners to make sure that we overcome any challenges in regards to the vaccine, especially when we're talking about misconception and vaccine hesitation. So it's really important that folks talk to their healthcare providers about eligibility to the vaccine. And what I mean by that is that you may have a pre-existing condition that prevents you from taking the vaccine now. And so we want to ensure that people stay safe, and that you've been approved by your provider to take the vaccine, considering your unique and individual conditions. How can we help right now? I know you're tired. You're sick and tired probably of hearing, wash your hands, wear a mask, stay home if you feel sick, and get tested. But it's really important, and it's going to take all of us to continue to do this. We do know that masks work. And when we're talking about washing our hands, yes, hand sanitizer is available, but soap and water is better. Testing should be done monthly. Before, we weren't aware of that. And so when we're talking about testing evolving, we're talking about the education of testing has also evolved, the lessons that we've learned regarding testing. And we know now that it's important if you're outside once or twice a week or frequently, and you're around folks, or you have folks coming to visit you and deliver, please get tested once a month. For folks like myself who are in high positivity areas giving out PPE, I get tested either weekly or twice a week. Some folks get tested bi-weekly, and that's okay too. But if you're limiting the amount of time that you're outside, we still recommend that you get tested monthly at no cost to you. This is our resource highlight take care package. And this is what I was talking about when we say, I plan on quarantining at home. This is what you can receive. My mom tested positive for COVID-19 during Christmas. I live in a multi-generational home. And so they did not know that I was the Manhattan Borough Outreach Director. So I went through the process just like everyone else. And so 3 days after they tested positive, they had asked her where she was going to quarantine. She decided to stay home, and this take care package came. So we have the mask here, hand sanitizers. One thing that I want you to note, it's called an oximeter there. That's a meter that we use to monitor the heart rate. The virus attacks your lungs, which decreases your oxygen intake, which impacts your heart. And so in order to monitor that, they give you the oximeter, but also you're going to be answering a phone call daily from the test and trace folks asking you how you're feeling to monitor. And they'll also be in touch with you, because if your condition does worsen, they want to make sure that you get to a hospital right away, and will be in contact with medical services. If you're not able to do that and you've turned for the worst, there's a thermometer there to monitor if you do have a fever, some Clorox wipes, and depending on the donations that the city receives, some goodies, some Nutri-Grain bars and whatnot. And you can also request an at-home testing kit. So this is not just if you test positive, but it's also if you've been in contact with someone who tested positive and identified you as someone they've been in touch with or close to, you can also request an at-home testing kit because you will also be asked to quarantine. So what does it mean in the interim? What is the city doing on the ground while we're waiting for mass vaccination, and what does outreach mean? In test and trace, we have three pillars. We have the testing, we have the tracing, and we have the take care program. Testing promotes underutilized testing facilities, locations, and we bring resources to underserved communities. Tracing team educates the communities to combat any misconceptions about the tracing process, and the take care increases awareness for take care resources within equity neighborhoods, highlighting the hotel program. During the month of January 2021, the outreach team in all 5 boroughs, these are some of the target audiences that we've been focused on for the month of January, but not limited to just these pillars, which are folks just like yourself, seniors, faith-based communities, nonprofit organizations, serving our equity communities, and the local bids and night shift facilities, just to name a few. January 21, this is what we had in the beginning of January. We've definitely overpassed 79 events. We've increased probably to 100 and 120 right now, just in the last 3 weeks alone, and we still have a week to go. So just to give you an idea of what we're focusing on, but not limited to, you know, this second and third week, we've still been focused on senior communities and working with faith-based communities to kick off MLK's week of service and to honor Dr. King. Next week, we'll be doing emerging immigrant communities, but it's also restaurant week in the city of New York in Manhattan. So a lot of the outreach events that I'm going to be working on in conjunction to emerging immigrants will be targeting restaurant workers, essential workers, the folks that are asking to dine in. You know, restaurant week is going to be very different. There won't be any outdoor dining because that's been prohibited and it hasn't been open to the city since December. But there's going to be a lot of deliveries. And we're also going to be focused on the flip side of that, right? Since the global pandemic, we know that there's been an increase in food insecurity. And so the needs and the dependent on our food pantries has really raised. And so we'll be doing work with and outreach with our most vulnerable communities and home insecure folks. These are some of the community partners and initiatives that we've been using for the month of January. Again, Gemma will email this out to everyone so that you can get a look, but I just wanted to show you some of the folks that we're working with on the ground in terms of outreach across all 5 boroughs. And so just this past Tuesday, we were able to link up with the Department of Health, who bought a mobile test unit to 333 Broadway. They heard that Test and Trace was going to be doing outreach there, and they bought a mobile unit. So I was really grateful to them for that, but so were the residents there because they have about 5 buildings and 15,000 apartments in that area. So a lot of seniors actually came out and were able to get tested, about 90 folks in just the period from 11 a.m. to 4 p.m. So that was astonishing and great. And then this is what I was telling you in the beginning. You know, these are important links. I know it looks like a lot. If you leave with anything today, remember 212 COVID-19. 212 COVID-19 is for testing sites. 212 COVID-19 is for resources that you may need, like the Get Food program, or God forbid, you want to request the testing kit, or if you need a hotel or recommend to someone who has tested positive. But you can also look some of the data up that I showed you in the beginning of the presentation from the Department of Health for yourself. You can stay up to date with some of that data. And also for Gemma, there's a link on there for posters and flyers for some of the facilities that you guys are at. or that, you visit and go to when you go to visit your clients and drop off stuff, you can request posters and flyers for free from the Department of Health on the second to last link on there. So just make sure that folks, I want to make sure that we have enough questions. So I'm going to stop sharing my screen now and give folks the ability to have any questions or comments.
So just to reiterate, thank you, Lorraine, for your taking the time to speak with our community. So just to reiterate, unfortunately, right now, we're still hoping on getting more vaccines and for them to become more readily available to you guys. And again, we're here as a resource if you need any help scheduling once they become more readily available. And there's a really big emphasis on making sure that we're continuing to do what we've been doing this whole time, which is wearing masks, social distancing, and making sure we're getting tested. I highly suggest the COVID number she gave. It's 212 COVID-19 or 212-268-4319. Again, 212-268-4319. For those who are close to Metropolitan, I've heard that line moves pretty quickly, and you can just walk in, and it's a walk-in clinic for you to get tested. Later in the afternoon is better, but it's always good to have that number to call to find out when the hours are, because they're not the traditional 9 to 5 hours. So definitely utilize that number as a resource. We are hoping that we will be able to provide testing on site, but again, we're providing you with updates as they come to us, and we want to make sure that you feel like you guys are kept in the loop. I had a question for you, Lorraine. I don't know if you can answer it. That came up last time, where some people were having issues where they may have received a bill from their insurance company for testing, but we do understand that testing is supposed to be free.
Sure. So I will find out about you. If you can send me that information, whoever has bills, forward that over. I know that for testing is at no cost to the patient. They do have to, audit, and show proof that we have been testing. At some of our locations, they ask folks if they have insurance, but no one should receive a bill for this, because we're asking the community to do this pretty frequently. So I'm sorry about that, and I'll get more information regarding that. But if you have any of those, please send that over to me so I can escalate it, especially primarily if they're a health and hospitals facility where they're receiving a bill from.
Okay. So I know I unfortunately had to mute a couple of people just in interest of background noise. You should be able to press *6 to unmute yourselves if you have any questions. This would be the time if you had any questions to ask.
I have a question.
Go ahead.
Oh, yeah, the side effects of these vaccines. Can you just give me a little info?
Yeah, that's a really good question. So some of the side effects that we've seen is first, before you get the vaccine, right before you walk in to get the vaccine, there's a questionnaire that asks you if you are taking any kind of steroids, if you have ever been allergic to certain foods or have had major reaction to it. And it's really important that you answer these honestly, because that will determine for the person on site. Can you hear me? That will determine for the person on site, the doctor administering this, or the healthcare person, if they can give you the vaccine. So some of the side effects are dizziness, a headache. You can even get a fever for a day or two. Muscle aches, especially in the ejection site, you will feel soreness. And so to avoid any other severe side effects, that's why it's really important for you to answer honestly the medical questionnaire that they'll give you right before you get your vaccine.
Just
Yeah.
to follow
Thank
up
you.
on that, it's really important that you also talk
Put
to
it
your
there.
PCPs, to your primary care physicians, just to review with them if you have any concerns based on your own health needs, to see if the vaccine is the right decision for you. Also,
No soft
next
drinks.
week, next Wednesday, we will be having a meeting with doctors at Montefiore. They will be discussing medical related questions to the vaccine. While we have the general info about the vaccine, since we're not medical professionals, we want to make sure that you guys can talk to actual doctors and get questions related to the medical components of this vaccine. So that meeting will be next Wednesday at noon, and I'm going to repeat the number 2 times. So whenever you're ready, grab a pen and paper. It'll be next Wednesday. The number to call in is 646-876 9923. Again, 646-876 9923. And if you're on the email list, this will be emailed out as well. And then the meeting ID for the meeting is 839 7244 9238. Again, 839 7244 9238. And that's next Wednesday, the 27th at noon.
Thank you.
Gemma, I wanted to mention something else. 2 things. One, I failed to mention that one of the side effects could be nausea, unfortunately, or vomiting. So forgive me, just because everybody's body is different. And then the other thing that I wanted to mention regarding the vaccine and vaccination is we have not gotten any data, any feedback on the difference on how the side effects approach different demographics, whether it's age or race or gender. So no one has reported anything different as of yet. We do not have that information. We haven't heard anything. So, I hope that instills some confidence in the vaccine.
Thank you.
You're welcome.
Yes, can I have the ID number for next week, please?
Yeah, I'll repeat it one more time. So 839
839
7244
7244.
9238.
Okay, thank you.
No lead in the account. No come in here.
All right. Does anyone else have any other questions for Lorraine?
Yes, I do.
Yep.
I wanted to know if there's a difference between the effectiveness between the Moderna cat vaccine and the Pfizer vaccine.
The effectiveness, no, there's no difference in that. I will tell you that the significant difference between the 2 vaccines is how they're stored. So they both need to be stored at very low temperatures. However, the Pfizer vaccine has to be stored at a significantly lower temperature than the Moderna, which is why also while we're dealing with the supply and demand situation right now all over the country, we're also working to overcome the barrier and challenges of refrigeration, just because they need to be at a certain level, and a normal refrigerator, even the refrigerators, I believe, in most of the facilities, restaurants, senior centers that we use are still not up to code to what we need to refrigerate the vaccine. So that's why we can't do mass distribution of vaccination in a lot of these facilities. Because of the storage barrier that we have.
Are they both 2 shots?
They're both 2 shots, and you have to take, if you took the Moderna, the second shot has to be Moderna. If your first dose was Pfizer, your second dose has to be Pfizer.
How much time do you take between shots?
Sure. So for the Moderna, it has to be 28 days, and for the Pfizer's between 21 and 25 days.
Okay, thank you.
You're very
Again,
welcome. Those are all very good questions.
Again, we will have doctors on the a call next week. So if you have more medical questions that come up, that would also be a really good place to ask those as well.
I just,
I
Gemma,
have I have a question.
Sure.
The center will let the people know when can we get the shots, the
Yeah. So
address or hospital or someone.
yeah. So the goal is that who's speaking?
This is Hilda Kingma.
Okay, so I'll make sure to make note that you're interested in receiving the vaccine. Again, if you're interested in receiving the vaccine, definitely give us a call. I'll repeat our number in a second. We're at right now, we're just assessing who's interested in receiving the vaccine. And we will reach out as soon as we're able to schedule people and, vaccines become more available. So that's our plan as of right now. But again, we do have a large group that we serve, so we will get to people as immediately as we can, especially those who have indicated to us that they're interested.
Well, I'm interested too.
Okay,
I
thank you.
couldn't get any vaccine in spite of that I was a Mount Sinai retiree and I just couldn't get any appointment. And I was in the group of over 75.
Yeah, it's unfortunately been very hard for people to receive vaccines. So we understand the frustration in that. And we want to be as helpful as we can. So I'm gonna give my
Anyone
number to
who
anyone.
can-
Sorry?
Anyone who can tell me how to get to schedule it, I would appreciate it.
Yeah. So as soon as we know of appointments becoming more readily available, we will definitely reach out to you because you've indicated that you have an interest in getting it. So I'm gonna repeat my number 2 times. So if anyone needs it, they can reach out to me. If anyone has any interest, they can reach out to me and I can make note of that. My number is 212-360-7620, extension 198. Again, 212-360-7620, extension 198. From what I've heard, you have to enter in my extension pretty quickly before you get disconnected from the call. So if for some reason you don't get an answering machine, just call back and try to enter in my extension
And
quicker.
when is a good time to reach you?
So since I'm not in the office, they're voicemails that are emailed to me. So I'll address them based in order of who called. And if you receive a call from a 505 number, that's my direct line, but I try not to give it out just so my phone doesn't get overwhelmed, but I will get back to you, I promise.
Thank you.
Can I ask a
Thank you.
question? Can I ask a question?
Yeah.
Hello?
Yeah, go
Can I
ahead.
ask a Okay, so you mentioned, I mean, not you, the person from Trace mentioned that they have a questionnaire that they ask, and if you have, like I read something in AARP bulletin that if you have like food allergy, which I do, have severe acid, so this is what I'm concerned about. That, and I also have a heart condition, so I don't know. Should I take it? Should I not take it?
So this is something that's definitely important for you to discuss with your doctor since they know your medical history better and they can address your questions specific to your medical needs and the vaccine. Again, also medical questions can be asked at the Montefiore meeting.
But
But I would
but I
highly
wanted to say
I
I
would
wanted to say something else.
Go
So
ahead.
the article that I read is talking about the Pfizer vaccine, and what it says that in mid-December the FDA was still working with Pfizer to make a determination on this point. They're talking just about the Pfizer, about this.
That's a really good point. And so I would say that you should talk to your primary care physician before making the decision of taking the vaccination, to echo what Gemma said, but also that you should know that when you're signing up for appointments to do the vaccination when they are available, you should ask what vaccine is available at most of these sites. So For instance, at most of the health and hospital sites, the Moderna vaccine is mainly available. Not for any particular reason that I'm aware of, other than probably the refrigeration part. Yeah, so you don't get to choose which vaccine you want to use. It's what's available at these facilities.
Okay.
Yeah, so just to kind of follow up with that, depending on what scheduler you use will indicate the vaccine. So with the vaccine finder, again, if you utilize like one of the social workers to help you schedule, we'll be able to let you know what information we have and don't have. So on the vaccine finder website, that's the website where you see each individual site that's a healthcare facility, and then you schedule individually on their website. They indicate what vaccine is available at that site. But just because they indicate that they have that vaccine there doesn't necessarily mean that they have available appointments. So that is the difficulty. But if you prefer one to another, you should make sure that you're indicating that when you're getting scheduled, so that whoever's helping you schedule, or when you're trying to schedule yourself, that you're aware to keep an eye out for that.
So,
But again, some places are more, the information is more accessible.
so is it?
In terms of
I want to finish. So, is it possible that say that your doctor said it's okay, and then when you get to the site and you fill up the questionnaire, is it possible that you're going to say, "Oh no, it's better that you don't take it," for whatever reason?
Well, maybe because that I was at a testing site this past weekend, and they did have to dismiss about 10 people because they lied about seeing their primary care physician. That was one. Two, they forgot to mention to their primary care physician and remind them that they were probably, or some folks saw a primary care physician, but not their own. So they weren't aware that they were taking certain steroids, which prevented them from taking the vaccine right then and there. Also, if you test positive for COVID-19 within 10 days, it means you should be in quarantine. That's number one, and you shouldn't be at a vaccination site, and you cannot get the vaccine while you are positive with COVID. But the other reason is two, because we it doesn't cure the virus right then and there as you have it. That's not how it works. It takes some time for it to be effective in your body. So there are various reasons why you may get turned away at a vaccination site even after you've gotten approved by your primary care physician.
So, if how soon so you need to take the test? It's better to take the test before you go to a vaccination.
I would absolutely recommend that you get tested before you go to a vaccination site. I would hate for someone to not know if they're negative or positive before they go to a vaccination
How
site.
many days before you should take it?
I don't know the standard number, but what would go with travel guidelines at 3 to 4 days before.
Okay, and also I'm taking atorvastatin. I think it's steroids. You said. I think that's what it is. So if somebody takes steroids,
that's something that you need to discuss with your primary care physician.
Okay.
Because there are certain steroids that would prevent you from taking the vaccine, for being approved for the vaccination. Yeah, so you need to talk to your primary care physician regarding that, and especially your heart condition as well.
Okay. Thank you so much.
Thank you.
Does anyone else have any questions? We're almost at the hour.
Yes, I have a question. I was going to ask a question about the COVID test, but the lady already did. So,
hello.
Yes, I was
Are
going
you
to
there?
ask you
Can
about
you hear
the.
me?
Yes, we can hear you.
Okay, listen, I tuned in late to this because I didn't realize the time, and a friend of mine just told me about it, and I'm so sorry. The bottom line with this whole thing is, I know they're out of the vaccine now, right? Or they're running short. Today is the last day. Is that it?
Today may be the last day, or tomorrow.
Right. How do I go about finding a site. I live in Queens, but I go to Manhattan. I'm staying with my sister in Queens. I live in Manhattan. I'm a member of your senior center, but I'm just helping my sister out in Queens right now. What do you suggest is the best way of getting online, getting an appointment, because everything is out, this, that, and whatever. And what do you suggest, in your opinion, about getting an appointment?
So I can kind of answer to that. So if you give me
I know
a
I didn't
call-
hear it. I'm sorry. I couldn't.
Yeah, I'm gonna repeat my number again one more time.
Thank you.
So basically what our efforts right now at Isaacs are is that we're reaching out to people, or if people reach out to us, we're making note if they have an interest in the vaccine.
Right.
So that when they become available, we have the list of people who have expressed interest and who want to be scheduled, so we can get ready to schedule them. So I would highly request that you guys call, and I'm going to give my number. Since we're not in the office, it goes straight to voicemail. But I get my voicemails and I'll get to them as they come in order. And this way we'll be able to keep track of the people that are interested in receiving the vaccine. So once they become more readily available, we will be able to reach out to you guys and get you guys scheduled. We want to get you the vaccine too, if you want it. So we're trying to get the information to you guys as soon as we get it and as soon as we hear it. And we understand that it's a frustrating process because you hear one day you can get the vaccine and then no more appointments. So we get it. We want to get you this vaccine. So I'm going to repeat my number one more time. 212 360 7620.
Wait. I lost it. 212-360. Then what?
7620. Extension 198.
Okay. 212-360-7620, extension 198. And your name, please?
Gemma.
Gemma?
Gemma, Gemma.
Oh, Gemma. Okay, Gemma. So what should I do? Just call this number and put my
leave a
name
message
in?
and say that you're interested in receiving the vaccine. You haven't been able to schedule, and then we'll make note of that.
Okay. Now, let me ask a question. I'm a member of Stanley Isaacs. That's why I get emailed from you, calls and whatever. My sister is 83. She has asthma. Can she get it through if you give her the information?
So you can leave her name and number in that voicemail that you leave for me. Just a reminder.
I can put her name in too.
Yeah, we don't have the vaccine at Isaacs, and as much as we're
no, but you're just giving information of how to get it.
Yeah, absolutely.
So it'll be good for her. It'll be good for me, both of us.
So as much as we're advocating to get you guys the vaccine and trying to get it at the center so it's more easily accessible, due to whatever restrictions there are based on temperature and storage and accessibility.
Yeah, the whole bit. Bit. Gemma, let me ask you another question.
Go ahead.
What's a site I could check daily on? What site do you recommend? Because there's so many different sites set up for this, that, or whatever. What site do you recommend I can check on the computer daily just to see what's available?
Honestly, I would suggest checking, just watching the governor and the or the mayor's briefings daily, because they're the ones who have the most.
So what is it? What is the site?
I have to look it up for you. If you leave me a message, I can call you back with it. And if you have an email address, leave me your email address in your.
I will.
In your message.
Gemma, thank you so much. Gemma, I appreciate all your help. Thank you. Thank you so much.
Alrighty, we have about a few more minutes left. Any last minute questions?
Excuse me, you said
I'm fine, thank you.
Excuse me, do we need to take a vaccine test before go to take the vaccine? Do we need to take the vaccine test before post or let?
It's not required, but it doesn't hurt to get tested, just so you know, because there are risks to testing positive and then getting the vaccine. So just for your own, security, if you want to get tested before you get it, it is suggested.
It's not required.
It's not required.
Okay, because it's not easy to get some place to get tested. When I pass some urgent clinic, there's a long line there, and they wait for a few hours. Sometimes scare me.
Yeah, it's been kind of difficult. If you live near the center, if you live near Metropolitan Hospital, I've heard that later in the day, it's easier to get in. I've heard of people only having to wait about 20-30 minutes in
It's
line.
more than that. Sometimes they said it's a 2 or 3 hours stand outside and cold.
Yeah, so it really
Wow.
depends on the day, and also depending on where you go to get tested. I know urgent cares are a really hard place to get appointments. I get tested every 2 weeks, and every time I go in, I make an appointment for 2 weeks from that date.
For urgent, you go to urgent care?
Yeah,
Genma?
but
You go to urgent care?
if I try to do walk-in, they don't do walk-ins because they
don't do,
literally run out of walk-ins by the time I get there. So I've heard very good things about people going to health and hospitals, like a public hospital, like Metropolitan or Bellevue, and it only taking 30-45 minutes to wait in line max.
In other words, to get
later in the
tested
day.
at Metropolitan.
But you have to
yeah.
travel to go there because we are close to your center.
Yeah, so Metropolitan's right on 96th Street and 2nd.
Yeah.
And I have a coworker who goes there for their COVID test, and they just walk in, and it takes them about 20-30 minutes to wait in line.
Or just walk in.
Yeah, they have a walk-in testing there.
On 96th Street and 2nd Avenue.
Yeah, the hospital there.
Okay, okay.
Yeah, but
Right.
again, you can also call the 212. Sorry, let me just scroll up to find it. It's 212 COVID-19 or 212-268-4319. I know that sometimes they're able to provide an estimated wait time and also the hours of operation for the testing sites, because they don't have traditional 9 to 5 hours.
Right.
The hours from day to day vary. So that's a good resource if you have any questions before you go and get tested.
Can you repeat the number again? 212-268?
4319.
4319. So where is the what place is this?
So that's just a general number for the city. It's like just a general number, but they have the resources and the information for the questions you have.
Okay, so we talk about Metropolitan Public Hospital, United Street there.
96.
So what time from what time?
Their hours vary day to day. If you want to leave me a message, I can give you a call back and give you that information.
I see. Okay.
Yeah.
Okay. Leave you a message to call your number.
Yeah, the 212-360.
Okay, 7620. Okay, guys, thank you very much.
All right, everybody.
Okay, thank you.
Thank you, Jen.
All right, everyone, just a reminder, next Wednesday, the 27th, we have the meeting with Montefiore with doctors who will be able to explain the medical components of the vaccine and answer medical questions related to the vaccine. And also, we highly encourage you talk to your primary care physicians about the vaccine in relation to your health needs. In addition, get tested. It's the best way for us to keep wraps on this on the virus, and make sure you're wearing your mask and social distancing. And thank you so much, Lorraine, for joining us
Can
again
I ask
today.
one more
Right,
question?
Gemma,